It will be cut off. Dr. Prithvi can start and Dr. Shishir Varghese can occupy the next podium.
Good afternoon, everybody. I'll be talking about Tactile, a tactile marker on medications for patients with low vision. This one of the award for Think Under the Apple Tree Innovation contest in all India. So basically, all we know that patients who have low vision, they have very difficult time actually identifying their eye drops and knowing how many times it has to be put. So that is when that was the problem statement to make eye drops easy to identify for the patient so that they don't miss the eye drops and there are more adherence for their installation of the eye drops. So we went through a lot of literature and we came across a lot of literature which actually told that misuse and inadvertent installation of eye drops are present. So what can we do and what is the solution for this kind of a problem? That was, we wanted a frugal tool which can be used. So that is where we came up with a tactile marker for medications. So our first prototype was bindis. This was the most frugal thing. It costs just 10% and you just need to put how many times the eye drops has to be put for the patient. The second prototype was a better one, that is a label embosser. It is basically a small strip of sticky tape which can be embossed with how many times it has to be put. So this can be actually cut off with the embosser and then you can stick it on top of the eye drops. So this becomes very easy for the patient to actually feel how many times it has to be put and they can use it for their advantage. So this was the second prototype. So this is how it looks once you attach it to the eye drops. So they can just feel 3 times and they can put the eye drops 3 times. This is the second prototype. The third prototype was using 3D printed machine. We actually made different shapes. So a triangle would be put for 3 times, a square would have been put for 4 times, and also that we can, keep a classification for these. Like triangle can be used as a glaucoma device. This one can be for lubricant, but it is not very universal. But this was our proposal. So these were the 3 types, and we conducted studies. And we found that there were adherence rate increased for our patients and patient missing at least 1 dose reduced by a lot, and patient reported it was very easy for them to use and satisfaction also increased and the patient confidence of using their eye drops also increased. So this way we were able to actually get good feedbacks from the patient. And this is how we actually enhance the medication identification, reduce the medical error, improve the treatment adherence, and patient's independence also, and minimize adverse effects. And it is not very costly, and it is very easy for us to do it in our daily practice. Thank you.
Prithvi, what was this award?
This was the Think Under the Apple Tree Innovation Award in All India.
Okay, congratulations.